Hi, I'm Dr. Harry Lausen, the Chief Medical Officer for SIU Medicine. And today I'm joined by Dr. Wendi El-Amin, the Associate Dean for Equity, Diversity, and Inclusion at SIU Medicine. Welcome. This is our first conversation we're having today about coronavirus.
Well, thank you for having me, Dr. Lausen.
Absolutely. So we want to talk a little bit about special considerations for the communities we serve. And one of the terms that we frequently use is social determinants of health. How would you explain what social determinants of health are for our patients and our communities that we serve, and why is that important even in the coronavirus pandemic?
Well, one of the things, when we think about the social determinants of health, as a family physician, I realize that I cannot get my patients healthy if they do not have the food that they need to stay nourished. I cannot get my patients healthy if they do not have finances to support them to be able to get the medications that they need. When we think about social determinants of health, even education plays a role. So right now, health literacy is playing out in the pandemic, where there are people who are hearing words that they don't understand, and that plays a role with the social determinants of health as well. So for example, working at our Family Medicine Federally Qualified Health Center, one of the things that we try to make sure we do is that we have a wraparound service around our patients, so that we are giving them access to food, we're giving them access to jobs, to make sure that they have what they need to be able to reach their optimal state of health.
Do you think that sometimes these social determinants of health impact or maybe keep people from reaching out to the healthcare system?
Definitely. I mean, when you think about the financial impact that COVID is having, when we move into the realm of telehealth, there are some people that don't even have telephones, that don't even have access to broadband, who don't have the internet, and all of that is going to play out. We're going to see how that plays out within the educational system too. So COVID is a unique disease in that it's not just impacting us physically, at the same time it's also impacting the way we're living in the world, and that's going to have a direct impact in our ability to get our patients well.
Okay. So I want to skip ahead a little bit to some of the other questions that we have been given that were submitted. The state of Illinois has created some or put out some data that they've collected, and the state of Illinois actually included race within the demographics or the information that they collect on these surveys. What have we found out or seen from the state data?
From the state data, we have seen that there has been a direct impact on communities of color. And when you're working in the field that focuses on health disparities, this is something that we have known, and I think that it's important that Illinois took the step to make sure that we are getting these demographics, because we can't heal and we can't treat what we don't know. And this is going to allow us to create some intentional targets into the community to make sure that we are providing the support that they need, the access that they need, and we're providing culturally responsive information so that the community truly understands the impact, so that they can navigate the healthcare system in a way that's going to allow them to become healthy.
Okay. One of the questions that we also were looking at was how social determinants are magnified in this crisis, or what we call a pandemic, and we might need to define pandemic. What does that really mean, and how is that impact then magnified? We've talked a little bit about the various impacts that finances have, health literacy, but there might be some other components of this that are magnified. But maybe you could explain pandemic and then why we're concerned about that.
Sure. You know, this is one of the first times that we have really started to hear this word pandemic, and I think it's important that we dissect what it means. We're normally used to hearing the word epidemic, and epidemic means that in one country or in one place you're seeing this uprising of disease. Pandemic means that it has started in one country and it has moved through multiple countries. So everybody is interconnected in this. I mean, we are in a global area, and unless we are paying attention to what's going on globally, it's hard for us to make sure that we are able to be as responsive and that we stay above the curve.
One of the other things we've heard a lot is the governor has put out a stay-at-home order, meaning they want us to stay at home whenever we can. Mm-hmm. We talk about social distancing, space between two people. We hear about avoiding groups of 10 or larger. That sometimes is a challenge in certain demographics and certain cultures. What do we want to say, or what kinds of things do we want to highlight, or activities do we want to highlight to say, you know, these are the types of things that might not be very good for you right now because we're trying to keep social distancing, that space between people, we're trying to stay at home as much as possible. What are some of the things we've seen in our community that maybe are important to address?
Well, one of the things I want to go back to, let's be very specific about what social distancing is. I know when I got here, I wanted to make sure that I was 6 feet away from you. And that's what social distancing means. I think sometimes we need to be very specific and say that we want to practice physical distancing, that we are 6 feet away from each other. I'm a little worried now that people are going to be wearing masks and that they're going to start thinking that this is protecting them. We need to make sure that even though they're wearing masks, that you're staying 6 feet away. The other thing is when we're telling people to quarantine, you know, sometimes we're saying go into your home and quarantine yourself, don't use the same bathroom. Well, you have some individuals who are living in a place where there's only one bathroom. So really trying to practice being as clean as possible, Cloroxing things down to make sure that when different people are coming into the bathroom that it's not being spread that way. I think that our community is really grieving on multiple levels, and that we've had some individuals who have actually died and people don't have the opportunity to go to the funeral in the same way. So making sure people are not showing up at the cemetery together and not practicing that same social distancing. Another place where we've seen individuals come out and playing basketball in the community, going to churches. I think that we've seen a lot of our churches move to online where they are starting to practice more of the social distancing. And that's hard, you know, it's really hard on multiple levels. I'm a mother of 3, and in our household, it has been very challenging. I have children that are from ages 11 to 16, and how they have been experiencing this has been very different. You know, my teenager, when you think about it, it's part of their development to be social individuals, and we have completely cut this down. And to make sure that they have other modalities to stay connected. When we think about children, to make sure that they are getting the support that they need around their education and that they're able to access the online school opportunities that people have, that's a challenge. Being a person who is working in the clinics and working at home, this is the first time I've had to manage my work and 3 other schedules to make sure that people are staying abreast. You know, recently we've been talking a lot about loneliness in the medical field, and I'm concerned that now that we know what the studies say about loneliness, that we're allowing people to understand that we still need to practice social connection. We need to be connected to each other. I want to go back to one of the other questions that you talked about, race. You know, Illinois is one of the few states that are starting to provide the data. And what we know about health disparities is that Black and brown communities are impacted at a greater amount because of access. They're also impacted because of some of the underlying diseases that are already high, like high blood pressure, diabetes, respiratory illnesses. And we need to make sure that people are aware that if you have any of these underlying comorbidities, that's what we're calling them, comorbidities, it does not necessarily mean that this is the end or that only bad things can happen to these individuals. It just means that we want you to be aware that your social distancing really needs to be practiced at a higher level so that we can protect you.
Along those same lines, are you aware of common myths that are out in the community that you've heard, or maybe someone from the community has contacted you to ask you questions about, I've heard this, and it's really a myth?
Right. A couple of things that I've heard is, Dr. Wendi, I heard that I can't get this. Dr. Wendi, I heard that because I am younger, I can't get this. If I gargle 8 times a day, I can't get this. Or I woke up this morning and I can hold my breath for 10 seconds, so I'm not affected. These myths can really be detrimental in every community, and that's why we need to be careful of where we're getting our information from. One of the things that I think is really critical is that people need to understand that there are silent spreaders, meaning the person next to you could actually be carrying coronavirus and be transmitting this if you're in that 6 feet of space. So people don't have a look. Illness does not have a look. You know, and I think that that's one of the myths that we need to make sure that we're addressing. So I was really happy that people are starting to come out. The other myth that I am hearing is that if you receive that diagnosis of being positive for coronavirus, that's it, that it's a death sentence. That's not true.
That's right.
You know, that's not true. And I think that one of the things that we need to do is to focus on trauma-informed responses. Everybody has their response to trauma. Some people fight, some people flee, and some people freeze. And if we keep pushing all the information that's scaring people, people aren't going to be able to move through this crisis in a way that allows them to obtain the information to be able to move forward. So when we look at statistics, this is another problem with health literacy. People keep throwing out all these statistics, but what do the statistics mean?
All right.
If you have 10 individuals, not all of those individuals are going to end up in the ICU,
Right.
or have a negative outcome. 8 of those individuals could do just fine, and everybody's body is responding in a different way. So I think that it's important that we're also giving people a sense of hope. I'm hoping that people who have made it through the coronavirus start to come out and create videos so that people can see that this is something that we can make it through.
You know, along those same lines, one of the things that we do here at SIU Medicine, when we find someone, because we don't know if everyone's got the coronavirus, we don't have enough testing right now.
Mm-hmm.
That's been an issue for many places in the U.S. So we are following individuals that have symptoms that are consistent with COVID virus. So we have a frequent touch base with patients. Some of them daily, some of them every other day, depending on how significant their symptoms are, how sick they are. And that's another way that we can stay in contact with patients to make sure that they're doing well. And there's lots of ways to do that. There's telehealth visits, and I know we wanted to talk a little bit about what that means, but there's also things just called a virtual check-in, meaning we could use a phone, a smartphone if you have it, a tablet, a computer, and then there's the official sort of telehealth visit. So let's talk a little bit about different ways that we can stay connected as healthcare providers with our patients to make sure they're doing okay. If they are ill, we want to follow up with them. We want to make sure they're doing okay. And we can do that without them having to come into the office.
Right. I think you touched upon a really good point, is that we also need to not only be taking care of the people who have COVID, we also need to take care of the people who don't have COVID, because one of the things that I'm seeing is that the mental health aspect of COVID is really starting to play out, dealing with the isolation, dealing with that anticipatory grief of, am I going to have my job? What's going to happen next? So I think that that's another place where we need to start putting some of our emphasis. But to go back to telehealth, this is something new. I know that I recently was talking to my mother and I said, you know, Mom, you can still get your doctor's appointment. You can do this through telehealth. And I wish that I could record the look that she gave me. And that's when I realized that at least my mother has the privilege of having a physician that can help her navigate that. And that's another thing, you know, sometimes this disease has shown us what privilege is, who you're connected with, whether or not you have a job that you can actually stay at home. There's many of our frontline workers, we talk about the healthcare workers, but you also have people who are working in grocery stores, who are driving buses, who are taking care of children. Our cleaning service is playing a tremendous role. I mean, these are our soldiers in this crisis, and we need to make sure that we're doing everything we can to protect them as well. But when we think about telehealth, telehealth is bringing your doctor into your home. And that's something that I think it's always important to kind of ask permission. I think that technology is new and that we will have the opportunity to be sitting face to face with you. It can even give us another glimpse of what your lived environment is, and we can help support you if you're having to be in quarantine, to come up with ideas of having to quarantine when you're in a different environment. So this is something that the physicians are getting used to. I think our community will enjoy it, but it is going to be a challenge. Technology is going to be a barrier, like I said before, with whether or not you have internet that's working, whether or not your phone is leaving, and we're really trying to help people navigate that in a way that's seamless.
Right. And even if, and again, we know that not everyone has even the basic telephone, but If you do even have a basic telephone, that's enough for us to get into contact with a patient. If you've got more technology, a smartphone, a tablet, a computer of some sort, even better. That gives us more access. But if we have a telephone, we want to talk to you, we want to make sure you're doing okay. So that is one of the key things we want to make sure we're doing.
I was excited that our school system is really getting more technology into children's homes, because that same technology can be utilized for the adults. So this was a win-win situation for us. One other thing that I wanted just to bring up is that we need to make sure that we are connecting with all of our partners. So our churches are partners, our civic organizations, our community safety nets are our partners, and we need to make sure that we're developing collective wisdom. So if you see us doing something that's not reaching somebody, you giving us a call and giving us that information is going to be really critical, so that that collective wisdom can be put in strategies so that we make sure that every person's life is being impacted by the work that we're doing.
That gives us a great opportunity to just mention our COVID hotline. So we have a hotline that you can call in. So if you have an idea like this that you're seeing that maybe we could help or assist with reaching a community organization to at least have a discussion,
Right.
We have a number for that. It's 217-545-5100. And we have people answering those phones now, I believe 7 days a week. So if you have an idea, please let us know. We'll be happy to work on that. I think we've gone through the majority of the questions that we had sort of ahead of time. Were there any other items that you wanted to discuss?
One thing I wanted to bring up is with telehealth, some individuals speak a different language, so I was excited to see that we're starting to make sure that that access is going to be on telehealth. So if there's a need to speak a different language, that the providers can actually access that as well. The other thing that I think it's important for us to really harp on is that this is something that we can get through. You know, that we are a resilient people, we are resourceful, and there's an opportunity for us to grow stronger through this. We have always used innovation here at SIU School of Medicine. I really hope that when we get through this, we're able to tell the story that people felt that they were being heard, that they were being listened to, that they were connected, and that they really felt that we were all in this together. When we have one vulnerable person who's being impacted, it's all of us. There's no separation, and that's one of the things that I think that this disease has shown us, is that it's not them and us, because the outcome of them is the outcome of all of us, and that's why we have to pull our resources together, dig down, look at the data, and create interventions and strategies that are going to make sure that every life matters.
That's a really important and great point. One of the things I wanted to make sure that we talked a little bit about today, or at least said it again, I know we've kind of said it already, everybody acting together, working together to do what we call flattening the curve, slowing the spread of coronavirus. That's our best strategy. Part of that is the 6 feet of distancing, as you mentioned. Part of it is staying at home, not getting into groups of more people or larger groups of people of 10 or more. All of that is what slows down the spread of this virus. And this isn't going to be over and done with in the next week or 2 or even 3. This is going to take some time. And the more that we do now, the more that we do the social distancing, the stay at home, to really sort of decrease the amount of spread we have, the better off we're going to be, and the quicker we'll get through this. And so we all got to pull together, help each other, support each other, but make sure that we're doing everything to maintain those particular things. That social distancing, that 6 feet, that staying at home is our best strategy to get through
medicine.
this.
I mean, that's the way I have
Right.
been trying to explain it to my girls at home. I said we have to take our medicine by being 6 feet apart from each other. And people want a magic wand that says this is when it's going to end. Every day we're getting new knowledge about corona. You know, before we didn't know that smell and taste could be impacted. So we're getting new information, and we just need everybody to be patient, because I think that everybody is trying to do their best.
Great. Well, I think we've gotten through all of our topics. I want to thank Dr. Wendi El-Amin again for joining us today to go over these really important topics. Again, our hotline number is 217-545-5100. We thank you for watching the video, and as always, stay well, stay apart, and continue to wash your hands. Thank you.